This video is about coding of inpatient procedures related to root operations, insertion and fusion. First we will look about insertion. The first example will be endotracheal intubation was carried out in the ED and the patient was placed on mechanical ventilation. So endotracheal intubation was carried out and the root operation will be insertion. So insertion of endotracheal airway into trachea via natural or artificial opening. So there are two ways of finding a code here for insertion of endotracheal airway. First, we can use the word intubation. So intubation here, and under intubation, we will be directed to see insertion of device in trachea. So we can directly go to insertion of device in and search for trachea. So we can use either intubation or insertion of device in. So the first three characters will be 0BH. So 0BH and search for the body part trachea. So trachea here and via natural or artificial opening 7 and endotracheal airway. So this will be the intraluminal device. So character 6 is device, endotracheal airway and no qualifier. Actually in this case sheet we should code for both endotracheal intubation as well as mechanical ventilation. But for now we will concentrate only on insertion. So the next example will be the patient with malnutrition, a nasogastric feeding tube was placed under fluoroscopy and nutritional substance administered later. So here the root operation will be insertion of nasogastric feeding tube. So actually in this case sheet also we should code for both nasogastric feeding tube and administration of nutritional substance. Hence we get two codes here. So one for insertion of feeding device and another for introduction of nutritional substance. So first is insertion of feeding device. So use the term insertion of device into stomach. So search for stomach to stomach 0DH6. So via natural or artificial opening. So 0DH and search for stomach here 6 and via natural or artificial opening, and this is feeding device. So U feeding device and no qualifier. And the second procedure will be introduction of nutritional substance, and this is under the administration section where we will use the term introduction of substance in or on. So because it is the substance, nutritional substance is introduced into only the upper gastrointestinal tract. So search for upper gastrointestinal tract. So first introduction of substance in or, next gastrointestinal tract, and under gastrointestinal tracts upper GI. So upper, and what we are introducing here, nutritional substance. So nutritional substance 3E0. So 3E0 and upper gastrointestinal tract, upper GI, and via natural or artificial opening, and here substance. See the characteristics here will be substance, not device. In the previous one the characteristics will be here device in case of insertion, but in case of introduction here the characteristics will be substance. Here substance is nutritional substance. So 6 is nutritional substance and Z no qualifier. Next example, the patient, a newborn preterm male infant delivered by C-section, a classical highly membrane disease was then developed and consistent with his 32 to 33 week gestational age and size. So here a catheter was percutaneously placed in the umbilical vein and advanced into inferior vena cava to allow ease in administration of IV fluids and medication. So here what is happening here, umbilical vein catheter placement. So catheter placed percutaneously in the umbilical vein, and important to note here is it is advanced up to the inferior vena cava. So here we should recollect some guidelines. See, if multiple tubular body parts are inspected, then the most distal body part, that means the body part which is furthest from the starting point of inspection is coded. So here, though the catheter is placed in umbilical vein, it is advanced up to inferior vena cava. So insertion of infusion device, the route operation will be insertion, and insertion of infusion device. So because here we are using the catheter, so insertion of infusing device via umbilical vein into inferior vena cava, and the approach is percutaneous approach. So we should use the term insertion of device in and search for vena cava. So vena cava. So here inferior vena cava. So inferior. So 06H. So 06H and up to inferior vena cava. We should not code for umbilical vein here. We should code for inferior vena cava. So umbilical vein will come as qualifier because here the catheter is placed up to inferior vena cava through or via umbilical vein. So the body part will be inferior vena cava and the qualifier will be umbilical vein. This is important. So fourth body part will be inferior vena cava and the approach is percutaneous approach, and here the characteristics will be again device, not substance. So device, infusion device, and via umbilical vein. So the character 7 will be umbilical vein, and the destination of the catheter, that is inferior vena cava, will be body part. So those are about route operation insertion, and now we will see about the route operation fusion. So before that, we will just go through some guidelines. So in case of fusion procedure of spine, the body part is always classified by the level of spine. That means either cervical, thoracic, lumbar or sacral. So the body part will be always classified by the level of spine, and each body part has a separate value. See, so the lumbar body part 2 and lumbosacral body part. So each body part is classified by the level of spine. And what if multiple vertebral joints are fused? Then we should use a separate procedure for we should use a separate code for separate procedures. See, for example, fusion of lumbar vertebral joint here. This is also a fusion of lumbar vertebral joint, but here the qualifier will be anterior column here and posterior column here, because we are using a different qualifier here, or if we use a different device, then they should be coded separately. So the multiple vertebral joints using a different device or using a different qualifier is they should be separately coded. And also, so what is the main objective of fusion procedure? To make or to render the joint immobile. So for that we will use certain devices like interbody fusion devices, certain bone grafts like autologous and non-autologous bone grafts. So for that there are certain guidelines. For example, if an interbody fusion device is used to make the joint immobile that contains either bone graft, the procedure is coded to device infusion body device. Understood? That means if an interbody fusion device is used to make the joint immobile, so that interbody fusion device should be given the priority. That means it is the device value will be for the interbody fusion device. If only bone graft is used as device, then we should code the device value as non-autologous tissue substitute or autologous tissue substitute. Understood? Here interbody fusion device plus bone graft or bone graft, you should code for interbody fusion device. So here only bone graft, then you should code for either non-autologous or autologous tissue substitute. Next, if there is a mixture of autologous and non-autologous bone graft, then you should always code it to autologous tissue substitute. Understood? So here are some examples. See, here in the first example, this fusion is done using interbody fusion device containing mostly bone graft, but it should be coded to the device interbody fusion device. Next, in another example, see, a bone double fusion device was used and mixture of bone and bone matrix is used, but you should always give the device value for interbody fusion device. Here, no interbody fusion device, but if they use both autologous and bone graft and bone graft, then it is always coded to autologous tissue substitute. So these are the guidance related to the materials or the devices used in fusion procedures. So let's apply those guidelines in certain case sheets. The first is fusion of occipital cervical joint with autologous tissue substitute. So we should use the term fusion and search for occipital cervical joint in the index. So fusion and occipital cervical. So 0RG. So table 0RG table, an occipital cervical joint, and the approach is open approach. So here autologous tissue substitute was used. So 7, and the approach is anterior approach, anterior column. Next, fusion of lumbar vertebral joint with autologous tissue substitute, anterior approach, anterior column, and open approach. See, fusion will be the root operation, and under fusion lumbar vertebral. So 0SZ. So 0SZ lumbar vertebral joint here, and open approach, autologous tissue substitute, and anterior approach, anterior column. This will be the qualifier. You should not get confused here with open approach and anterior approach. This is for actual approach and this is for qualifier, character 7. Next, fusion of occipital cervical joint using nano-textured surface interbody fusion device, open approach, and new technology. Whenever there is a mention of new technology, you should code from the section new technology. So you can use the term new technology here. So new technology, and under new technology search for fusion. See, under fusion, occipital cervical. If you go from fusion to directly from fusion to occipital cervical, then you are coding in a medical and surgical section, but here you should code in new technology. So new technology, fusion, and under fusion you should go for occipital cervical, and under occipital cervical nano textured surface. See, nano textured surface. So that means in order to code these type of procedures, you should have an understanding that nano textured surface is given a separate entry in the index. So when you know this point that nano textured surface is given a separate entry here in the index, then you can directly come to this nano textured surface. But if you don't know that nano textured surface is given a separate entry, then you may always miss with coding with direct fusion. So under new technology, so fusion, occipital cervical, and nano textured surface. So XRZ. So the table XRZ, occipital cervical joint and open approach, and interbody fusion device. See, nano textured surface, and new technology group 2. So here character 6 will be either device or substance or technology. Understood? So here the root operation will not change. The root operation is same, fusion, but here new technology. So thanks for watching. Please subscribe to learn more about inpatient coding. Thank you.